You're listening to The Range, WGWG.org, Gardner-Webb University streaming and on-demand radio. Got the Jeffs in the studio this afternoon. Jeff Powell, that's me, and Dr. Jeff Hartman.
That's me.
Mr. Exercise Science. And today we're talking about exercise and pregnancy. Is it a good idea?
Yeah, the old school recommendations, women don't exercise, stay in the house,
right,
stay off your feet, you're eating for two. And of course, that's all wrong. And I think what's leading the push in research is we are becoming fatter and fatter, and there's that genetic piece to obesity, and then the whole nature-nurture thing. Either way, having fat moms is not good for your kids.
Okay.
So let's stop telling pregnant moms to eat for two and stay off your feet. Let's start telling them, based on their initial weight when they are pregnant, there's guidelines on what is considered an acceptable, safe weight gain. And then let's get them to move. It's a great time when you're pregnant to even begin exercise if you haven't. The old recommendations were if you're exercising, keep doing whatever you're doing with some modifications. But now the latest guidelines say even if you're not, it's a good time to start exercising when you're pregnant. The recommendations are pretty much similar for non-pregnant women. So it's 20 to 30 minutes a day, preferably every day of the week, moderate, intense exercise. There are some contraindications or things to avoid, like, obviously after your first trimester, any exercises on your back are going to be difficult to do. Obviously avoid contact exercises, maybe exercises where fall is a risk, like step aerobics. And then any type of long distance training because of heat issues and your child's getting too hot. But the benefits are huge. There's lots of benefits associated with exercise, including less gestational diabetes, less preeclampsia, fewer C-sections, less lower back pain, less pelvic girdle pain. Lower frequency of urinary incontinence. There's some anecdotal evidence to suggest quicker deliveries, quicker recoveries. So the benefits for pregnant women to exercise are vast. The risk, I think with a little common sense, are minimal. And also, let's not forget the benefit of establishing a healthy routine that you could pass on to your child.
Oh, very fascinating stuff. So sometimes the conventional wisdom needs to be updated.
Yeah, absolutely. That's what we're seeing.
If you've got any questions or comments for Dr. Hartman, just email us here at the station. We'll pass it along. That's info, info, at WGWG.org.